I'm going to call now the next group. Ladies and gentlemen, we are going to start with a parent that is here with us today, and then followed by Donna Mae DePaulo, the President and CEO of Resource Training Counseling, and then we'll go to Bill Fusco, the Executive Director, Dynamic Youth. Donna Mae, can we introduce the parent? Could you introduce, if you wish?
Sure. Yes, I'm sorry. Every time Anne-Marie speaks, I get emotional. But this is Anne-Marie Parada, and she's our new Director of Operations for the new detox that will be probably opening July 1st. So.
Hi. On April 10th, 2011, I lost my son, Christopher, to a prescription drug overdose at the age of 22. My son not only had a drug addiction, but a mental health disease. As you may know, drug addictions stem from not only mental health disease, but also by peer pressure and lack of education, knowledge, and awareness of what these drugs do to you physically, mentally, and how it destroys your loved ones. There should be education for all medical fields, law enforcement, Board of Education, parents, children, and the community on prevention, along with understanding that this is a disease and it should be treated as if. For instance, if your child or relative had cancer, you support him. Get the correct medical attention and support their disease. As cancer, if you are in the recovery process, you will continue your treatment because of the unknown. My experience with this disease is that not only were we treated as if we were criminals, but also looked at by the community as bad people due to the lack of knowledge and education. There is too much judgment and not enough knowledge. Also, as a parent, I was uneducated on this disease, and I took the advice of others because I didn't know where to turn, and I was misinformed how to handle my problems with my son, like tough love. Kicking him out on the street and not standing by his bedside, fighting this disease, I did not follow my heart, and I live and suffer with the regret every day because bad advice. I feel like I killed my son. My journey in life is to help others get the help that I could not get for my son. I went through courts. I wrote letters to judges. I went to treatment center after treatment center and was denied the detox. It took me 12 and a half hours one day to get my son help when he finally came to terms and said I need it. I went to rehab. They said I couldn't put him in because he was on benzos, which were clozapams and opioids, okay? I went to a detox, and they said because he was on benzos, they can't take him. I went to the emergency room, and the doctors said, we can't help this. Until they saw him taking the pills out of his underwear, because they stripped him down. He had a stash in his underwear, and popping 3 and 4 pills at a time. They tied him down and released him 24 hours. When he got out, he wanted to come home, and I said, sign yourself into a detox now. You're allowed to. He didn't. A couple of days later, he came home and said, Ma, I went to the hospital because my heart hurt. My son's lips were purple and swollen, so that's a sign of heart failure. I brought him to the hospital, and I begged the emergency room to get the psych ward involved because my son was killing himself. Where else could I turn? Because the courts, the police, rehab, detox, nobody was helping me. So I went to the emergency room for the psych ward. I told them I'm not leaving here until my son is signed in. That's it. I stayed until 2 o'clock in the morning waiting for the psychiatrist. They signed him in, and my son's last words to me were, Christopher, I need you to grow old with me. And he said, Mommy, I'm not going anywhere, because he had no clue on what was going to happen. He left me and his sister heartbroken. There's no help. And when you get the help, they treat you like garbage because of this disease. Nobody is educated on either or. If you have a mental health disease and a drug addiction, nobody wants to get their hands dirty because it takes too long of a process to heal. And that's what my experience is with a lot of people, my son's friends, my son, family members. And I have parents coming to me because they saw my commercial. I spoke for the health department. We came out with the I-STOP program. I was there. I did the commercial for them. I speak with the DA, first Dan Donovan, and now Mike. I now work for Donna because there is no judgment in the place that she has. We will not deny anyone. And if they are willing to get help, which I still don't understand that part, because you're high, you're not in your right mind, and you have that right to go to jail or a drug program. Let's see, my son got arrested with 234 pills. They said 30 days in jail or go to a drug program. What would you choose? He was not in his right mind, and he shouldn't have had that right, no matter what age he was. The doctor, what I think is a court should give at least 3 months evaluation if they think they're a drug user. A mental evaluation and a drug evaluation. And then they should be placed. This needs to be funded. Because just throwing them in jail or giving them the option, there should be no option. They're not in their right mind. Law enforcement has no education about this. They get annoyed when you call them to try to come and help you. Denial treatment centers I spoke about. When you're in treatment centers, they like to kick you out quick for the little things that you do. Now, withdrawal comes with behavioral problems, and everybody should understand this. We not only have to educate, but we have to stop denying that there's an opioid and heroin problem. And everybody, as you said before, is in denial. How my son started with these pills is he got into a minor car accident, and a doctor prescribed him Perk 30s, that they call it, right? For a minor back injury. My son got a list of doctors that you could get these drugs from. When I went to bring him in program, they gave me another list because they wouldn't accept him in that program unless he was on Suboxones. $300 to $500 a prescription, and $300 for the visit. Okay? To try to get you off the Suboxone, the opioids. The doctors are still writing prescriptions, but now for a higher price because of the risk. That's right, they should get their license taken away. They went to school to save our children or save our lives, and they're killing us. That's how the heroin epidemic came about, is the doctors writing these prescriptions. So, we are opening a detox in Brooklyn because of the need and demand in our community. Our detox center will be a no-judgment zone. And if we cannot take them into our facility due to medical issues, issues, we will take them to a facility that will fulfill their needs and not just throw them into the street. And that's another problem we have. But we won't stop there, because I didn't have anybody to turn to. We will not only treat the addict, but we are treating the family as well. We feel it is necessary to help families that lost their children and families that are struggling to keep their children alive. Thank you.
No, thank you, and there are a number of children in this audience today, or I shouldn't say children, young men and women, that have been given a gift by God by having the ability to get into a program and save their lives, and to be able to bring their families together. Unfortunately, that did not happen with you. And you're not the only mother out there that is without a son or a daughter. And unfortunately, someone today in this community or close to this community will have the same. They will lose a son or a daughter to this terrible, terrible scourge of heroin. All I can say is that my prayers go out to you. But I would ask you strongly, do not live the burden that you think you killed your child. You did not. You did everything that you could possibly do. So please, for your own sake, don't live with that. You're a young woman. You have many years ahead of you. We all feel your pain here today, but don't live with that burden. Please. And thank you for your testimony.
Thank you.
Thank you.
Hi, my name is Donna Mae DePolo. I'm the president, CEO of the Resource Counseling and Training Center. We have two outpatients, thanks to Senator Marty Golden and the Community Board 10. We recently opened in Bay Ridge because of the opiate problem. I think Billy Fusco and all the other people here at the table probably can, for me to go through the same thing again and answer these questions, I think will be redundant. So I'm going to pass it on to Billy, actually.
Bill, before you start, is there somebody, I've seen somebody else from Staten Island here, from another detox group, or who was here just a little while ago? Did he leave? No? I thought I seen one either from Task or from a Daytop. Okay, I'm sorry. Go ahead.
I usually don't read, so bear with me. I will
Bill,
start
you can
reading,
read, Bill.
But then what I'm going to do is I'm going to go to my old self and talk off the cuff, which is more my style.
I like your Brooklynese.
And, you know, this is my neighborhood. Me and Donna Mae grew up in the same neighborhood a couple blocks from each other, although we hung out in different crowds, but same idea, Sunset Park. And let me just say for myself, I was a very lucky young man because I was in a lot of trouble at 23 years old, and I found my way into a drug program through very little effort of my own. You know, there was a guiding force that I didn't understand at the time, but it gave me a chance to, it gave me a second chance instead of going to prison. And in that process, I really believe that I've lived my life understanding that I owe back. And it's been the most important thing in my life to be able to owe back and see where we are today. Like some of us at this table, I'll just say that we're in the eye of a hurricane. So what I see is many times some of the victories, Senator Golden and Senator Amador, and we see some really wonderful, wonderful victories. People going back to college, some becoming physician's assistants, nurses.
Mike, if I can stop you short, there's some of the victories here in the community, if they could stand up.
Absolutely.
Some of the victories in this community want to stand up, please. Stand up, kids. Give these kids a round of applause, ladies and gentlemen.
And on the other hand, let me just say about this epidemic, that we don't go past a week without hearing of somebody passing away. So let me just start with my testimony, and then I'm going to read a little letter that was from a while back from a Marie de Gregorio, from actually this neighborhood here. Good afternoon. My name is William Fusco, and I am the Executive Director of Dynamic Youth Community. DYC's main offices are located in Brooklyn. We have a residential program located in Fallsburg, New York. For over 43 years, we have been providing long-term residential treatment and outpatient services to adolescents and young adults between the ages of 13 and 25. I am testifying on behalf of all the young people and their families we serve, as well as the hundreds and thousands of people who are struggling with opiate addiction. Thank you, Senator Golden, Senator Amador, and Senator Murphy, and Senator Ort, for inviting me to testify today. I am pleased to provide my recommendations on how we could work together to fight this epidemic that has destroyed so many lives over the last decade. Beginning in 2008, DYC saw a shift in drug use from street drugs, crack cocaine and other drugs, to prescription drugs, specifically opiates. It quickly became apparent to us that young people were able to access these drugs much easier than street drugs. As we began to understand how highly addictive and potent these drugs are, early in 2008, we began to alert OASIS officials, community leaders and legislators, educators, and the media about this new trend and the danger we feared. We were met with much resistance from most of the people we talked to. People just couldn't understand that this was possible. They certainly didn't want to believe it would bring us to where we are today. It is important for me to note that very early on, Senator Golden and his staff were highly concerned about what we were reporting, and continually made efforts for us to express our concerns to the appropriate officials. Unfortunately, it took a number of years, too many in my opinion, for a call of action to occur. By 2015, 23% of our admissions reported prescription drugs, and 72% are heroin primary drug. This total is 99% of our members in Dynamite, which number over 175. 99% are addicted to one degree of opiate or another. And if I can just say, when we first started to see this, it was 20 and 30%. There's always been some heroin in Brooklyn, always. Brighton Beach was a hotbed of heroin for years and years in the 80s and 90s. But the spike that happened from 20% heroin to 72% heroin, you know, is something that has never happened for us in Dynamite. And what we're trying to do is adjust as fast and as quickly as we possibly can to the demands that this takes on. Where we are today, we have iStop, a statewide public awareness campaign, widespread availability of naloxone, limited expansion of treatment options such as additional residential beds and medication-assisted treatment, and in comparison to the enormity of the problem, a small amount of additional funds to address this epidemic. Still, we need to do more. According to the National Institute of Drug Abuse 2014, there were 11,000 deaths in the United States from heroin, 18,000 from opioid pain relievers. This is tragic. In New York State, overdose deaths continue to rise. We need to do more. Providing the appropriate level of treatment for someone with an addiction is often a challenge. There is no magic bullet, yet there are options. This can't be a one-size-fits-all approach. For example, researchers from Harvard Medical School and Dartmouth College determined that young people between the age of 18 and 25 were substantially less likely to stay involved in buprenorphine programs than older adults. In other studies conducted by CSAT, researchers concluded that for adolescents and young adults, family involvement greatly improved treatment success. OASIS has licensed providers OASIS must provide more resources for these approaches. Whether the approach is long-term residential, outpatient, or medicated assisted treatment, I'd like to say treatment assisted by medication, with counseling, more resources, and expedited application processes should be implemented immediately. In addition, programs and activities that raise awareness need to be implemented statewide. DYC has always considered it a responsibility to talk to the community, especially the kids, on the dangers of drugs. We have been doing this for 43 years. About a year and a half ago, DYC and Kings Bay Y were awarded a grant to raise awareness in the Brooklyn Russian-speaking community about opiate addiction. This initiative has been extremely beneficial. In DYC alone, we have had over 40 admissions as a direct result of our work. Hundreds of phone calls came in as a result of weekly radio shows we participated in, and we were able to direct people to the appropriate level of care they needed. We should be doing more projects like this statewide that focus on the specific needs of a community. We are still amazed at how little people know about this issue, but at the same time, we see a shift in the stigma, especially among our young people. They are reaching out and asking more and more questions. Everybody knows somebody who's addicted to drugs. Once again, I would like to thank Senator Gold and the members of the Joint Senate Task Force on Heroin and Opiate Addiction for the opportunity to testify today. In 2012, and I'm not going to read the whole thing, but Maria Di Gregorio, who lives on 73rd Street, which is a walking distance from here. You could be there in 5 minutes. She writes, "Today on January 12th, 2012, I've come home from another funeral, sad and heartbreaking. Giuseppe had just turned 18 and died of a drug overdose. I find myself feeling helpless and angry, and so angry. I can't help but think that this could have been my child, my little girl. Giuseppe's tragedy could have been my family's nightmare. I feel such anger and rage. Number 8, the 8th death of prescription overdose drugs in my neighborhood, Dyker Heights, Brooklyn, a good neighborhood with good kids and private schools coming from good families. I can't help but feel rage. I want to stand up on street corners and scream, when? When is someone going to realize what is happening? When is somebody going to do something about these drugs? These are legal drugs. These are legal drugs. It is out of control. It has become an epidemic. I'm angry, so angry. Doesn't anyone see what's happening? Doesn't anyone care? Hello, these kids are real. They are dying. Why isn't anything being done? I hear state wants to cut funds for drug treatment. They want to minimize long-term treatment. Are they crazy? Are they trying to kill our kids? There are many parents that share my anger, and we are tired of being neglected and overlooked." She goes on to explain that her daughter came into Dynamite and is in her 11th month at the time in 2012, and that she found out that her daughter was on drugs because she had a skiing accident. And in having a skiing accident, they needed to give her some narcotics to ease the pain. Well, they gave her the most massive, they gave her as much narcotics as they possibly could give her, and she was still in tremendous pain. So there, the light bulb finally went off, and they realized that they had a daughter that was addicted. Thank God, Elisa, at this point, is now working to become a dental hygienist. She's 3.5 years clean and doing very, very well for herself. I did want to read the last paragraph because it's very, I think, appropriate for where we are today, sitting here in Dyker Heights. Because in the last paragraph, she says, "Please hear me. Please, I beg of you, for our children, grandchildren, and nephews, brothers, sisters, and friends, please hear me as I rage inside for the lost lives of young kids and adults in my life and in my neighborhood. Within 4 years of time, there have been 8 deaths of overdoses. Stephen, 16, Azel, 17, Gaetano, 23, Mike, 20, Ahmed, 19, Mario, 55, Danny, 26, Giuseppe had just turned 18, and my dear, sweet, loving brother, Frank, who struggled with addiction for years. They didn't want to die. This is something that is happening. This was addressed to Governor Cuomo in 2012, and I think finally there might be an answer to what's going on in a drug epidemic, and I can't applaud you guys more, stepping forward. I've known Senator Golden for, a number of years now, and he's a staunch supporter and talks straight and direct. But what we're starting to see now is all the parts of New York State coming together. As much as I say all of what I can say, I try to do my best with it. We got some guys from the program here. I could fill up this hall very easily if I had a little more time. But we pulled some guys together that wanted to come and stand up as you did with them, because our guys really do feel like that they want to let people know who they are and what they're doing for themselves. So maybe it makes it a little easier for the next guy down the road who needs to come into a program. I also want to say that, what we're going to concentrate on right now is our workforce. Our workforce has been depleted tremendously. One of the things that really helps a program stay consistent is when you have a stabilized workforce. When you can only pay people $28,000 and $30,000 and $32,000 after 5 years' worth of experience, they can't stick around. And that experience is so necessary for what we do. So it may sound a little self-serving, but we need to stabilize this workforce as best as possible, and we're going to be talking with you guys about that. The other thing I just want to do is extend an invitation to Senator Murphy and you, Senator Amador, to come visit programs. Come out to Brooklyn. Come see Dynamite. Come see Donna Mae's program. Come talk to the guys in there. That to me is the biggest. I'll call it a learning experience. We have another term for that, but a learning experience that you can have, because right there, I think when I need my batteries charged, I talk to these guys. And I know sometimes in the work that you're doing, maybe once in a while, coming to a program would help you and help you get your batteries charged a little bit. So with that, I thank you again.
I'm not out here to give any advertisements, because you all do a very hard job, and you continue to do that each and every day. But you're live, right? So as you're live, we're getting a number of emails responding. I got one here, and I don't know if I should go live. I won't go live with the name. Dynamite Youth Center is an amazing staff, saved my life. The heroin epidemic is out of control, and we're losing our kids. If you have a teen, young adult struggling with addiction, go to Dynamite. They'll locate it and give you your address. You will not regret it. And that is people responding to what's going on here today across our community. So your son went home. Many sons and daughters have gone home. Many of our kids, young men and young women, unfortunately go out a second time or a third time. There may be no second chance. There may be no third chance. And I think your letter comes to the point, and your testimony here today goes to the point. We need to get more services and more money into programs. We need to get more people out of addiction and into these programs. And we need to be able to support the families during, before, and after the crisis. So I want to thank you, Bill, for your comments here today, and yours, Donna May, as well.
Mr. Fusco, if I may ask you a question. You mentioned in your testimony